I know it's super commonly talked about, myomas, leiomyomas, fibroids. Like what are these things?
Yeah, so fibroids are smooth muscle tumors. So if you think about the uterus is made up of smooth muscle, and fibroids are just like a bundle of smooth muscle tissue that grows on the uterus. And it can be located in different parts. It can be inside the uterus, it can be in the wall of the uterus, or it could be outside the uterus, kind of on the surface of the uterus. And they can be, different sizes, and can cause different symptoms based on their location, and their size. But
So how do
and
we get
most
that?
How do you get them? That is $1 million question. There's so much research that's still being done on how someone gets fibroids. So often we know it is genetic. A lot of patients will say like, "Oh, my mom had fibroids, my grandmother had fibroids, they needed surgery for it." There are more and more studies that are coming out linking diet and fibroids, and high
Oh,
estrogen diets,
interesting.
high inflammatory
I,
diets. Fibroids also affect African American women disproportionately, and women of color. And there was one theory that like hair straighteners, or relaxers that Black women used were, implicated in this. So there's some different, theories that are going on, but there are more studies that are coming out with diet, and for sure, unfortunately, genetics, does play a role as
right.
well. So,
Oh, so
yeah.
interesting. Okay. And talk to me about symptoms. So what, if you have a fibroid, like how would you know that you had a fibroid?
Yeah, so that's a good question. Actually, a lot of people don't know they have a fibroid. So they were doing a scan for something else, and the doctor said, "Hey, by the way, you have a fibroid." And the patient's like, "What? Nothing is wrong with me." So oftentimes, the most important thing to remember is fibroids can be completely asymptomatic. So you may have no symptoms. But for those who actually are experiencing symptoms, they can be pain, pressure, bloating, bladder pressure, abnormal bleeding is a huge one. So very heavy periods, irregular bleeding, and then fertility. A lot of patients will have miscarriages. They're not sure why. Then they, get a more detailed workup, and boom, they have a fibroid. Or they're not able to get pregnant, and then they realize they have a fibroid. So there can
Yep.
be some of these more silent symptoms, and then some of the more overt symptoms like the bleeding and the pain and the cramping.
Are they?
What was that?
How common are they?
How common are they? So by the time you are 50, almost 80% of the population 80% of women will have a fibroid. So very common.
I had no idea. I always quoted about 50% of reproductive age, but that makes sense by the time you get to menopause because it is so common. Wow.
Exactly. Yes.
Wow.
And 90% of African American and Black women. So it's common.
Yeah. So basically, in your circle of friends, at least one person has fibroids.
Exactly.
Yeah.
Exactly.
Yeah.
Yeah.
Wow. Okay. So if you are thinking about fibroid, you think you might have symptoms, or you think as part of your fertility workup, you want to assess for fibroids. How are fibroids diagnosed? What's the best way to look for them?
So the most common way fibroids are diagnosed is via an ultrasound. So a
Okay.
simple pelvic ultrasound, no radiation. It is a probe that goes in the vagina to really kind of see really well the uterus and the ovaries and the nearby structures. So that's the most common way. If they are diagnosed that way, and then you actually want to do something about it, do surgery, then oftentimes your gynecologist may say, "You know what, let's get an MRI." To look at it a little bit more in detail for surgical planning.
And can you explain a little bit the difference of why, like the ultrasound versus the MRI? What's the pros and the cons of that?
Yeah, so the good thing is both of them are no radiation, ultrasound and an MRI, but an MRI often is more expensive. So we want to start out with just the most common, the basic, the easiest modality, which is an ultrasound. And if you can clearly see, oh yeah, it's 4 centimeters, this is exactly where it is, it's not really invading into the near the tissue nearby, then you're done. You don't always necessarily need an MRI. But sometimes it's a little hard to tell. Sometimes it may be kind of growing into the nearby tissue, which would make surgery a little more difficult. And your surgeon would want to know that prior to you going under anesthesia and going to the OR. So if you want a little more detail as to exactly the location and the nearby features of the fibroid itself, then an MRI is often recommended.
Got it. And then talk to me about saline sonogram or HSG or for submucous fibroids.
Yeah, so it's often called a water ultrasound, and
Okay.
this can be done in a lot of gynecologists in the office, or definitely reproductive endocrinologists like yourself do them in the office, where it's an ultrasound, but right before they look at the images, they put a little catheter into the cervix, and they, using a syringe, just inject a little water or saline, salt water, to help get the cavity a little bit bigger, so they can really pinpoint, is there a little polyp, is there a little fibroid in there? It just helps your doctor see a little bit better, and it can be
So
done
like
quickly in the office.
standpoint, it can help to see if it's in the cavity or not.
Exactly, in the cavity, how much is it jutting into the cavity, and then does it need to be taken out, especially if you're somebody trying to conceive.
Perfect. Okay, so then kind of shifting gears to what everyone is curious about. When we talk about treatment, I typically break it down kind of into an umbrella, and I talk about lifestyle changes, I talk about supplements, I talk about medical therapy, and then I talk about surgical therapy.
Hmm.
So as our fibroid expert for the afternoon, can you walk us through those four and what you would recommend to somebody with fibroids, and specifically for my patients, somebody who's trying to get pregnant?
Yeah, great. That's great overview there. So for the sort of the lifestyle modifications, trying to have a very clean diet. So reducing the inflammation, reducing a lot of sweets. For some people, that means reducing gluten, flour, and then also eating cruciferous vegetables. So if you look at the data, there's two studies that have come out, one from China actually recently, that does show that cruciferous vegetables actually can shrink fibroids or
Wow.
reduce their recurrence, can reduce their recurrence. So a lot of broccoli, cauliflower in your diet is really great. I generally suggest a plant-based diet to my patients. I think we're going to find more that comes out in this area, but a plant-based diet, exercise, kind of holistically taking care of your body, lowering stress, moving, and just really taking care of your body, I think is number one. And that's just not for fibroids. As you know, it translates to so many other benefits in life and in medicine, but definitely for fibroids, that's what I suggest first. Number two, supplements. So I don't really specifically champion any one supplement over the other. I think there's a lot out there, and it's very difficult to say, like, okay, which one is legit? I mean, every day I feel like there's another ad about some other
Yep.
powder that you should be taking to detoxify yourself from fibroids. But really, like, is there a lot of, information about this? I'm not really that sure. So when patients ask me for supplements, I mean, it seems great, like a quick fix, but honestly, in good conscience, I can't recommend a supplement. Now, integrative functional medicine doctors do have, some of them have told me, yes, I have helped shrink fibroids. But if you really look at what they're doing, it is going back to that number one thing, which is lifestyle.
Gotcha.
They're looking
Gotcha.
at your diet, making sure your cholesterol, your thyroid, all of those things are tuned up, right? So it's going back to the basics. So that's what I would say there about that. And then medical treatments, I mean, we've got a whole host of them, and that really depends on what your symptoms are. So, for example, if you're somebody with bleeding, then we can definitely use birth control pills. We can use the Mirena IUD, which I love.